So urinary tract infections are usually caused by an infection in the bladder. There's bacteria introduced into the urine that then becomes very aggravating to the whole urologic system. Most often it happens in girls, but occasionally it does happen in boys as well, and that can be anywhere from a few days old to teenage years and beyond. We work with those kids to figure out what the underlying causes are. Common underlying causes for urinary tract infections are incomplete bladder emptying, where the urine is left behind and remains stagnant in the bladder. Other issues include anatomic issues, where there's actually some variance in how the kidneys and the bladder are connected. It's called reflux, where they can have urine going up into the kidneys, and that causes stagnation and bacteria. Sometimes it's hygiene related, but most of the time it's some sort of emptying concern or hygiene concern.
Urinary tract infection symptoms can vary widely from just foul-smelling urine to pain with urination to fevers, back pain, and vomiting. Sometimes I have children come in to see me who have a history of recurrent urinary tract infections and they don't have urinary tract infections at all. A lot of times children have what's called dysfunctional voiding, where they have urine withholding behaviors just because they're 4 or 5 and they're potty trained and they get busy and they don't want to go to the bathroom. So they hold their pee and then it causes some bladder dysfunction, and so really one of the easiest things I can do to help them and help their parents is just tell them to drink more water, go to the bathroom, and try to urinate more often, and a lot of times that fixes the symptoms. That's actually a lot more common than children who have actual structural abnormalities to their kidneys or their urinary tract and have true recurrent urinary tract infections.
So a lot of things we help with urinary tract infections. We instruct kids on better voiding habits. A lot of times kids are busy, so they wait too long to go pee, and then the longer the pee sits there, the more likely it is to become stagnant and become infected. So we work on time voiding schedules where they're peeing every 2 to 3 hours. We make sure that they empty their bladder, so we talk them through a series of exercises to relax all the muscles, to make sure everything is working together, and they're not just hopping off and kind of going about their day without fully taking the time to focus on going to the bathroom. Sometimes we'll use antibiotics. If there is an infection, we obviously want to protect the organ system, so we'll use antibiotics to treat infection. Every once in a while, we'll use antibiotics to prevent infection while kids are relearning how to use their urinary system to empty more appropriately. And in rare cases, there's surgery that is indicated to help treat the infections due to the anatomic structures that may be variant.